All right, guys, this is Health Nibble number 104, and the Health Nibble is why do I gain weight after I lose a bunch of weight? And you don't have to gain weight after you lose a bunch of weight, but what we find a lot of times, we have a highly successful weight loss system. People lose weight really fast in a really healthy way, get off to their medications, all their biomarkers improve. But when they go off the program, a lot of times they gain weight really fast. And so what I want you to understand is a metabolic set point. We actually talked about that earlier when if you eat a standard American diet, which is terrible, and then you just start trying to reduce caloric load, you start losing weight, you get so hungry from ghrelin. It's actually a hormone problem. So which to get around that, actually, fasting, intermittent fasting, partial fast. I mean, these fasting strategies work a lot better to control those hormone levels. But that's not my point today. My point is addressing the metabolic set point. So, people tend to eat a standard American diet. They have high insulin levels, they gain a ton of weight, and then they kind of hit a certain point where they've hit insulin resistance, and they're not gaining a lot of weight anymore. But their health is, their sugars just fill in their body, and their organs are getting damaged and all this stuff. And they so for years, for decades, and then unfortunately lose a bunch of weight and expect to keep it off. And it's just not that easy. So with most things in life, you get what you pay for. And, if you're going to have lots of bad eating, you're going to have to pay for it with lots of good eating or a good lifestyle for a long period of time. So, you're not gonna reverse 10 years of bad eating and insulin resistance, things like that, in just like 6 weeks or 8 weeks. So if you're thinking that, it's just not gonna happen. So, but here's what I want you to understand to keep you motivated to stay clean for a long time is this metabolic set point. So let's say you're 250 pounds and you join our program and you get down to 190 in like 12 weeks. And then you just kind of get burnt out on the whole health thing. So you hit like 24 weeks or so and you start eating, 3 meals a day and eating the standard American diet, and you have grain and sugar, and you're pretty much eating like bad food through the weekend, but pretty good Monday through Thursday. All that weight is going to come back. So once you have changed your metabolic set point, sometimes you can get away with a little more of that. But when your body hasn't been in that clean eating, lean, fat burning mode for a year, it's going to have a tendency to want to go right back to where it was, and sometimes past that. So does that mean, oh, it's just too hard, you just don't do it? No, you get a coach so that you can make the commitment, learn the lifestyle, change your habits, change what you buy at the store, change how you make your meals, change your choices when you go to restaurants for a year or longer. And then that's how you're going to ultimately change your metabolic set point, where you can have a little more leeway. But if you haven't done that for decades, it's just not, that metabolic set point is not going to change like that in like 6 or 8 weeks. So I've just had lots of conversations about that in the last week or two. So it's just inspired me to do a health nibble on it, because even our patients and clients that go through functional medicine, our weight loss program, I'm not sure we've made a strong statement about that. I mean, we tell them to follow the program for results, but I think maybe if you knew there's a physiologic reason that you put weight on really fast, then maybe it would help people stay motivated, so we really change the community and change the world the way we want to. So that's your health nibble for the day: metabolic set point.